And there are new worries this morning over a respiratory illness blamed for nearly 200 deaths worldwide. For the first time, MERS has spread from one person to another right here in the United States.
The CDC says an Illinois man got the virus from an Indiana healthcare worker who brought it from the Middle East. Their only physical contact, a handshake. Our Dr. Holly Phillips is tracking the case. Holly, good morning.
Good morning, Charlie.
A handshake?
Yeah, it's actually very concerning because, as you know, up to now, our focus has been on what we call prolonged close contact. So healthcare workers who've come into contact with a person with MERS or someone who actually lives at home with a sick patient. In this case, we know the two patients met briefly twice. Their longest meeting was just 40 minutes, and each time they shook hands. So that's not really considered close contact. So what the CDC is going to have to look for is if the virus is simply more contagious than we thought it was before, or if it's changed in some way.
Because my understanding, MERS, what we thought about it is that it's not easily spread, that there has to be some prolonged or close contact. This suggests something else.
It really does. Again, 40 minutes together and a handshake is not very, very close contact.
And he was asymptomatic, right? He didn't exhibit any symptoms.
He was. That's the other twist in this. We do know up to 20% of MERS cases can be asymptomatic, or the symptoms are just so mild that people don't notice them. On one hand, we think that's a good thing, that the virus can be mild. On another, it might allow for it to spread quickly without people even realizing that they're spreading it.
What's the risk of fatality?
Worldwide, it's a very serious illness. About 30% of the documented cases have been fatal. So it is a very serious illness. The two cases here, though, both patients were very sick. They got supportive care. There is no cure or vaccine, but they got supportive care in the hospital, whether it was oxygen or fluids, and they both turned the corner. So it might be more treatable than we have thought before.
All right. Go ahead.
I was just going to say, should Americans be worried at all?
No, this is not something to worry about on the day-to-day, but it's really important that we stay vigilant, and it's great that the CDC and the World Health Organization, they're both all over it.
Yeah. Thanks, Holly.
Sure.